Hello, this is Dr. Gay from First Look MRI, and this is a 60-year-old female who has had cervical surgery, and the outcome is not quite what she had hoped. She continued to have pain, shooting pain into her arms and neck pain, muscle spasms, and here we can see why. So on this view, we see her chin here in front. This is her brain stem and her spinal cord that goes down through the spinal canal. And when it gets right here, we see that there is narrowing. There's a spinal stenosis here. Previously, she had a significant stenosis. There's just a mild stenosis now, but the doctor went in and took off some bone and back, did a surgical decompression, opening up the spinal canal somewhat, but not all the way. There's still no fluid in front or behind the cord. So up here we see fluid in the front, fluid in back. We have plenty of room for the spinal cord to move around, but here, very tight. There's no fluid in front or back, and the spinal cord is minimally compressed. Down below, we see the normal fluid in front and behind the cord. So she has a persistent spinal canal stenosis. And typically, doctors will go in and not just do the posterior decompression in the neck. They'll oftentimes go in the front, and they'll put a metallic plate along the front. They call it anterior cervical fusion. And they'll go in there and fuse that in front so the vertebral bodies will maintain a normal alignment. But this patient has abnormal alignment. The striking thing is the upper cervical segments. Here's 1, 2, 3, 4. The top segments here are angled forward towards her jaw, and then the bottom segments are aligned at a totally different angle. And this C4 vertebral body is slipped forwards. We see C5 instead of being nice and square like C4 or C3. Here's C4. I'm sorry, C3, C4. These are square. This one is rounded along the front. So the C4 vertebral body is slipped or subluxed forwards, and it's articulating along the anterior and superior margins rather than just along the top. So there's degenerative remodeling from this. The C5 and C6 vertebral bodies are fused surgically together, and again, this has really prominent subluxation, abnormal angulation. So she is still having pain from muscle spasm, and they're going to need to go in there and do the anterior metallic plates to fuse this and get her alignment back. But in a case of prominent anterior subluxation of C4 relative to C5 post-op, a poor surgical outcome with continued pain and subluxation. Thank you very much.